All right, well, staff and families, this is Jason Carr, Communications Director for Crook County School District. And we have a special guest today, Muriel De Laverne Brown, who's the Director of the Crook County Health Department. And we're just gonna have a little conversation here about COVID-19, schools being open, vaccinations, and just to provide everybody with some more information. So Muriel, we appreciate you joining us.
Thank you.
And we appreciate too the health department's partnership and collaboration with the school district since we reopened in September. And that's probably where I think we'd start first is, that's really been one of the drivers behind being open has been the partnership with the health department. So can you talk a little bit about the importance of that and sort of why the state set it up that way where the local health departments would have a say and play that role with school districts?
I think for us, it's really been, we've always had a really good relationship with the school district. We have students actually that participate with health department programs and help us. And I think for us, it was important to be able to not only provide some guidance, but also we know that if there's any outbreaks or anything happens, we would have to work hand in hand to kind of shut those down and make sure that we're providing the best information for the school. So my nurses work with your school nurses, and if anything happens, they're right on top of it, making sure that if we have a case that would come up, that we make sure that that child or whoever is not going to school, so it's not spreading. So I think we've worked really quickly and really fast to make sure that the school has been safe. I think some of the other roles that we've really played is we've tried to provide as much personal protective equipment, whatever you've needed. We've made sure that we've provided that for the school. So I think answering questions, this has kind of been a moving target. So just being available to be able to provide that support for the school, I think has been really important. And Katie Plum has been really the point person doing that. And she's done a fabulous job working with the schools. So
yeah, we've appreciated Katie and the weekly update that I think you're going to attend later this afternoon has been really helpful, not only for us at the district office, but for our staff in general, just to, so that they have information. Because as with everything that's going on, there's so much information out there
right.
that, it's hard for people to understand sort of why we're open and why we're doing what we're doing, which I guess is the second question is, a lot of people are seeing we've had this spike in cases since Thanksgiving.
Right.
And, all the public health experts are saying there's probably going to be another one here in the next week or two after Christmas. So what would be the rationale for continuing to allow Crook County schools to remain open and then even consider, full-time at the end of the month, 1st of February from a public health perspective?
I think as long as the school district works hand in hand with the health department and the school is really, I think one of the things that you've done is really follow the rules around making sure people are wearing masks, making sure people are distancing, and really providing the guidance to not only parents, but kids in the school to make sure that's happening. I think schools are really safe. I feel like the schools are safe. We have not had we've had a few cases here and there, but we have not had case-to-case spread in the school since we started. And I talked to Jill about that, who's the nurse that's working really closely with Wendy. And we've really, really stayed on top of it. So we haven't had what I would call, a true outbreak or anything like that. We've had times that we've had to isolate different groups and things, but we haven't had additional cases. So it feels like whatever we have done with the schools and all the work we've done and all the work you're doing, it feels like it's been successful. So I would say we stay the course and we don't, we continue following those guidelines, and I think we'll be fine. And I think for us, we're hoping as we're starting vaccine, distribution, that we also will see a decrease in cases. So it's going to take a little time, but we're working on it.
Yeah, and I think it's that, one of the things that's important for, our own staff, but parents and community members to know about, it's that management side of it. We didn't reopen ever thinking that the virus wouldn't affect our schools, or even potentially that there might be a small spread somewhere at some point. But I think that what we've shown after 4 months is that when you follow the safety protocols, as you just mentioned, and then, you guys helped us to design basically a response plan anytime it does touch the schools, that you really can successfully mitigate and also target your response on a school by school basis, rather than saying, oh, there's a couple of cases in the high school, now the entire district has to shut down. You can just deal
No,
with
I
it.
think that's part of the investigation piece. And that's why the piece that Jill does working with Wendy is so important, because when Jill does the investigation, she's able to figure out, like who's really at risk, what do we need to do, and then making sure people are following those isolation guidelines. And that has really worked.
So talk about the trend that people are likely to see probably over the next 4 to 6 weeks in terms of kind of case counts, or you see them spiking again and then going down. Is that kind of generally what the thinking is?
Yeah, I mean that's sort of what the trend we think we'll probably see. I have to say the other piece too is Crook County has been really fortunate that we have really mitigated a lot of things in relationship to even counties around us, number of cases. And so the joke with some of my nurses at the beginning of this was they were trying to put a bubble over Prineville. So, that didn't exactly work, but we tried. I think we may see some uptick in cases, but in reality, we are still at pretty much 100% for reaching out to cases when we find out there's a case. I think what's important for people to know is if there is a positive, it's really important for them to respond to the health department and answer those phone calls, because if they don't, we have to mark it as a sporadic case. And that means we don't know where it came from. And that sort of goes against our metrics. So we always have to be, reminding people it's really important. Just if we give you a call, it's going to be very simple. We'll just do a quick investigation and try to keep anybody else safe. So I think those are all the important things that we will continue to do from our side, but we have maintained that metric of almost 100% for reaching out to positive cases.
It's interesting you say that, because it goes against what I see on social media, which is, hey, don't get tested, don't let anybody know you're sick, because that'll close schools. And really it could actually have the opposite effect, that the more as a health department, the better you can manage it, which in turn ensures the schools can stay open.
Right. And I think the other thing too is, honestly, the more people that are tested, and many of those may end up being a negative test, that actually it's just math. If you only have a few people tested and those happen to be the ones who are sick, who are positive, it increases that
positivity rate.
Yeah.
Right? So
it's pretty simple math. So it's honestly, more people being tested sometimes helps those numbers.
And then the last thing is the vaccinations. I know I saw, like, for example, Dr. Natalie Good at the hospital. She's been posting some videos on YouTube about, getting the vaccine, and we're kind of in the initial stages. So going to talk about where you're at, what the next steps are. And I know teachers are sort of in the first phase of access.
Right. So we have, this past week, we received our first 100 doses. In about a day and a half, we gave 55 scheduled. We basically had people called who were on the 1A list. So it's that first responders and all that group. So we're working through that healthcare group. We have a full schedule this week. We did receive another 100 doses, or will be receiving another 100 doses this week. I know that doesn't sound like very many, but what we're hoping is eventually that Mosaic will receive vaccine, St. Charles, as far as the clinic, and there will be other providers, hopefully pharmacies in the community also. So as far as the teachers, one of the things in a small county is, it's optional for people to get the vaccine. We're encouraging it. We have not had any reactions of the vaccines that we've provided. People have been really excited and happy to be able to get it, to feel safer, and we go ahead and make the appointment for their next dose. we actually are at a place, I was going to announce this afternoon, but we're at a place that probably in the next couple of weeks we can start, or even potentially next week, we can start vaccinating school staff.
Oh,
So I know that's kind of a surprise, but we actually have moved through the first groups pretty quickly of the ones who want to be vaccinated. And we just got a memo actually today. There was sort of a listing. It was groups 1 through 4. Teachers were either number 4 or number 5. But now after the governor's comments yesterday, we received a memo that says we can do things concurrently. So we don't have to go 1, 2, 3, 4. We have pretty much gone through, I mean, we're still going 1, 2, 3, 4, but we're actually doing things concurrently. So we're calling out to different groups that fit into those categories and getting them on the schedule. So we still have to kind of figure out what's the best. I don't want, 400 people to call my front desk at once for the school district. So we kind of have to figure out that schedule a little bit, but we're getting pretty close to the place that we can start vaccinations with our school staff.
And we've kind of reiterated to parents that, there's no mandate that kids have to be vaccinated. In fact, when we had met with you and Katie last week, you had mentioned that the Moderna vaccine, which is mostly what's coming here, is not even recommended for anyone under 18. So
That is
we're not
true.
Really talking about students at all.
No, we're just talking about basically sort of the healthcare, our education group, and then there's a vaccine advisory committee, which is a state level committee that I have actually been appointed to, that we will have our first meeting on Thursday. And that group will look at the rest of the groups in Oregon and look at kind of what's next and how do we make sure we do that. So there are actually 2 of us in public health that are on that committee from Central Oregon. So
I know this is kind of a big out there question, but how long is it going to take with the vaccine distribution and enough people in the community getting it to the point where we can say we've really turned a corner and maybe we could start looking at, doing away with or maybe pulling back on some of the, the safety measures? Are we looking at spring?
I think nationally they talk about, having 75% to, of people vaccinated. That's a little bit, but I think, the more people that get the vaccine, the ability to kind of go back to normal lives, I think will be better. So we encourage it. I know that, the people that have come in here have been incredibly thankful to be able to get it. Some, I think the more people that get it and we don't have any outcomes, I think people see on the news, it's like, oh, someone had an allergic reaction and they ended up in the hospital. Well, that's not a good thing. But at the same time, that can happen that happens with other things. It's not just
all vaccines, right?
It's not just vaccines, it's peanuts for some people have reactions and you have to use epi. So I think the number of reactions across the country, the number of reactions in Oregon, I think there's been 1. So it's pretty, when you think of all the vaccines that have been given, the chances are pretty slim. And wherever you're getting the vaccine, we have EpiPens, we have, whoever is giving it has all the things there if somebody did have a slight reaction. So I think those are the kind of things that people get concerned about, and we make sure we mitigate all that. So.
And of course, I think you're very well, given what you do, that there's definitely concern out there, or people that are just like, yeah, I'm not sure that I'm comfortable with it.
Right.
What do you generally say to somebody who is skeptical about the vaccine?
I think, it is personal choice if they want the vaccine. I think that's important for people to understand. Vaccines have been around for a very long time. The process to make this vaccine was very safe. The reason it was faster was because the technology now is so much better than it was back in the day when some of those vaccines were created. I'm in my 60s, but I grew up getting vaccines. Many of us have grown up getting vaccines, and I think I tell people to read the research, look at the science. This is a very effective, both the Pfizer and the Moderna are very effective vaccines. And I think they will make a difference for all of us.
So once you do get the vaccine, obviously there's that second dose.
Right.
Kind of what I'm hearing is that there's still sort of this, you can't just, that means everything goes back to normal. Like there's still probably going to be the need to wear masks and still think about social distancing for a while.
I think for a while, I think, you know, you hear different people say different things about when it might change. I think, you know, if a person gets the vaccine, as an example, if they get the Moderna vaccine, usually 2 weeks after the second dose, they're at that point, they're considered to have pretty good immunity. But because there's so many other people, you know, they haven't said this totally prevents, it prevents you from being really sick. And hopefully it prevents you from getting it. But, you know, there's still a lot of unknowns. And so, you know, I would encourage people, it's still important until a certain number or percentage of people are vaccinated that people take some kind of precautions. You know, I don't know if I'll fly again without wearing a mask, even if I had the vaccine. So
yeah, I
like that, you got to think
for
about
a couple of years for work and was on an
Yeah.
airplane a lot. And looking back, I kind of realized how gross airplanes are. About right? I mean,
That
they
is
just
true.
are.
We've all learned that now. I know. And yeah, I flew a fair amount too. And yeah. So
Yeah.
anyway, but you know,
All
it's
right.
been a pleasure working with the school district. I think the relationship we've had in Cook County with the schools has been somewhat unique compared to some of, you know, I think all the health departments across the state have tried really hard, but it's very difficult in counties that have many school districts. And I think our relationship and just being able to kind of do this journey together has really helped not only public health, but it's helped the school district and getting our kids back in school.
Yeah, and we'll continue a Tuesday update with the health department every week. And we, you know, we've tried to be as open and transparent as possible. We've started sharing weekly with our staff, you know, when there are cases in the buildings, for example. The number of staff or students, we don't, obviously for privacy,
Right.
we don't give much other information. And, you know, anytime there's a quarantine or exposure in the schools, we send a letter home to parents and let them know. And then of course the nurses, and I think this is what's really helpful, is the nurses are contacting the families individually about the need to quarantine. And that gives parents an opportunity to ask questions and sort of understand
Right.
things better. And we'll continue to do that as long as, you know, we need to for the rest of this school year until we, you know, get back to normal. But yeah.
Well, and we can't say enough about your school nurses and the role they played in this too. I've worked with Wendy for a long time, and I know Megan is new, but they are doing a great job working with our staff.
They have worked many weekends.
I'm sure.
I've
We
gotten
have
phone
too.
calls. I've gotten phone calls on, you know, a Sunday afternoon. Oh, we need to get a letter out to parents. You know, there was an
Yep.
exposure that, you know, just, and that's the way it is. But, you know, I have to say too, our parents have been extraordinarily understanding and patient with us, you know, with the process. Nobody likes to wear masks. Nobody likes
Right.
all the social distancing protocols, but you know, it's what we got to do right now to keep things open. And
Right.
and we're lucky to have you guys as well to help us along and make sure we can open the doors, and hopefully by the end of this month get the middle and high school students back in, you know, full time.
Yeah, that would be great. I think our school district has been very lucky compared to many across the state that haven't been able to start. So I'm glad to see everything kind of moving in a better direction across the state too.
Yeah, I kind of discovered that in some of the conversations with the governor and ODE, that Dr. Johnson, our superintendent, has, that I think in many cases, Cook County School District was a bit of a test site for the state. I mean,
Right.
you know, we're the largest school district that's been open, and, you know, they have
Right.
seen our outcomes. And I think that kind of helped them understand. I mean, I know they've looked at a lot of data, information across the country and even the globe of other school districts, but having one, you know, that's actually open in your state and has done
Right.
it successfully, it just adds to that data and that information you need to make that decision.
I think that's true. And I think people were really appreciative that the school district here was able to do that. And we were really, really glad to help. So.
Yeah. All right. Well, Marielle from the Health Department, thanks for
Thank you.
joining us and thanks for all your work. And we look forward to meeting with you guys on a weekly basis.
Absolutely. Talk to you soon.
All right, thanks, Marielle.